8 warning signs of cervical cancer you shouldn't ignore. More than 40 years ago, cervical cancer was a major cancer death risk for women. With the development of Pap tests and in-depth recognition of warning signs, those numbers are dropping significantly. We still aren't completely safe, however, as many thousands of American women are still affected by cervical cancer every year. Picking up on risk factors and warning signs could save an individual from a lifetime of suffering. Cervical cancer risk factors. Acknowledging the risk factors that make women more likely to contract cervical cancer will help women to reveal a greater insight to their cancer risk. Human papillomavirus infection, HPV. There are over 100 different viruses grouped here, and some are spread through skin contact and considered a stepping stone to cervical cancer. Detection of HPV is usually through the discovery of warts or Pap smears. Food intake. Overweight women and women that have a diet devoid of essential nutrients from fruit and vegetables face a higher risk of cervical cancer. Birth control pills. The female hormones found in some oral contraceptives may provide some cancers with ideal breeding grounds. Also, the risk of cervical cancer goes up the longer a woman takes oral contraceptives and doubles after 5 years of using them. Genetics. There are conflicting references regarding this issue. Some references claim that cervical cancer is something that can be passed down among family members, giving women with a genetic history of the cancer about 2-3 times more of a risk. However, I've seen other references that claim that there is no genetic component to this type of cancer. HIV. The virus that causes AIDS damages the immune system and increases the risk for HPV infection. Chlamydia infection. Women who show signs of past or current chlamydia infection have a higher risk of cervical cancer. Smoking. Women who smoke double their chances to get cervical cancer. It is believed that tobacco byproducts damage the DNA of cervix cells and may contribute to developing this cancer. Smoking also affects the immune system, making it harder to fight HPV infections. And indeed, smoking is one of the top 10 habits to stop right now if you want to be healthy. Multiple pregnancies. Women who have had 3 or more full-term pregnancies have an increased risk of developing cervical cancer. No one really knows why this is true. First pregnancy at a young age. Women who were younger than 17 years when they had their first full-term pregnancy are almost 2 times more likely to get cervical cancer later in life than women who waited to get pregnant until they were 25 years or older. Warning signs of cervical cancer. In the earliest stages of development, there is typically a frightening lack of visual and physical symptoms to foreshadow onset stages of cervical cancer. Many symptoms aren't evident until the cancer has begun an invasive spread to surrounding tissue. Some of the most typical symptoms are as follows. 1. Leg pain. Some women exhibiting early stages of cervical cancer experience swelling and pain in the leg. When the cervix swells, it can lead to an obstructed blood flow, which eventually causes the leg to swell and gives a sore, painful sensation. 2. Vaginal discharge. It's normal for a woman to experience small amounts of clear discharge without color or odor. If the output of discharge increases, smells foul, or has any type of irregular appearance, it could be a sign of onset cervical cancer. 3. Unusual bleeding. Of all the symptoms, this is likely the most common. If a woman is experiencing an untimely bout of vaginal bleeding, it could be an indicator of cervical cancer. Consider contacting a physician if you experience persistent bleeding in between menstrual periods or following sexual intercourse. Women who are postmenopausal and no longer have periods should pay close attention to this symptom. 4. Discomforting urination. Keeping track of urination can help reveal the presence of cervical cancer in several ways. The most immediately obvious and prevalent symptom is discomfort while urinating. This is normally described as a tight and concentrating stinging sensation, but it can take on several different discomforting sensations. Usually when urinary symptoms are involved, the cancer has spread to nearby tissue and requires immediate attention. 5. Irregular urination. The appearance of the urine and urinary habits can also be symptoms of cervical cancer. If you notice strange changes in the frequency of your urine, loss of bladder control, incontinence, or a discoloration, especially with blood, seek the input of a medical professional. 6. Irregular menstrual cycles. There should be some level of consistency when it comes to monthly periods. If time, frequency, or any other changes disrupt the regular routine, it may be linked to a future with cervical cancer. Take note of any medication you are on and consult a physician if inconsistencies persist. 7. Uncomfortable sex, painful intercourse, otherwise known as dyspareunia, is another discomforting side effect of cervical cancer. There are several possible reasons for this symptom to develop, as is the case with many of the symptoms on this list. This symptom is most commonly linked to conditions that require medical attention, however, so it shouldn't be ignored. 8. Pelvic pain. Pelvic pain is a fairly routine burden of being a woman. Cramping and aches during a menstrual cycle are perfectly normal, but when pain lasts for longer periods, happens frequently, or becomes more intense than usual, it could beckon a look from the doctor. If you liked this video, don't forget to share it with your friends and family. Subscribe to my channel and give us a big like. Thank you for sharing your time with me and have a nice day.